I'm going to read to you an article published by Global Research on March 27th, 2020. The link to that article is in the notes below this video. This article, posted by author Julian Rose, is basically a copy-paste of a presentation from a medical forum. The original presenter, identified as a widely respected professional scientist in the U.S., prefers to stay anonymous, because presenting any facts or information which may be contrary to official narratives can cause negative consequences for any medical professional who discloses that information. I have edited the article for clarity without changing its meaning or implications. And I quote, I work in the healthcare field. Here's the problem. We are testing people for general coronavirus, but we are not testing for any specific strain, such as COVID-19. There are no reliable tests for any specific COVID-19 virus. There are no reliable agencies or media outlets for reporting numbers of actual COVID-19 virus cases. This needs to be addressed first and foremost. Every action and reaction to COVID-19 is based on totally flawed data, and we simply cannot make accurate assessments. That is why you're hearing that most people with COVID-19 are showing nothing more than cold or flu-like symptoms. That's because most coronavirus strains are nothing more than cold or flu-like symptoms. There are a few actual novel coronaviruses, and those cases do have some worse respiratory responses, but still have a very promising recovery rate, especially for those with prior issues. The gold standard in testing for COVID-19, the one that could identify COVID-19, would use laboratory-isolated and purified coronavirus particles, free from any contaminants and particles that look like viruses but are not, that have been proven to be the cause of the syndrome known as COVID-19, and obtained by using proper viral isolation methods and controls. But the type of testing being done, some of which are referred to as PCR, do not detect the virus as such. PCR tests, which stands for polymerase chain reaction, basically takes a sample of your cells and amplifies any DNA to look for viral sequences, such as bits of non-human DNA that seem to match parts of a known viral genome. The problem is the test is known to not work. It uses amplification, which means taking a very tiny amount of DNA and growing it exponentially in a laboratory until there is enough of it to be analyzed. Obviously, any minute contaminations in the sample will also be amplified, leading to potentially gross errors of discovery. Additionally, it's only looking for partial viral sequences, not whole genomes, so identifying a single pathogen is next to impossible, even if you ignore the other issues. The test kits being sent out to hospitals are totally inadequate and unprofessional. At best, those test kits tell analysts you have some viral DNA in your cells, which most of us do most of the time. It may tell you the viral sequence is related to a specific type of virus, say the huge family of coronavirus, but that's all. The idea these kits can isolate a specific virus like COVID-19 is complete nonsense. And that's not even getting into the other issue, viral load. If you remember, the PCR test works by amplifying the minute amounts of DNA. It is therefore useless at telling you how much virus you may have. And that's the only question that really matters when it comes to diagnosing illness. Everyone will have a few virus kicking around in their system at any time. Most will not cause illness because their quantities are too small. For a virus to sicken you, you need a lot of it, a massive amount of it. But PCR testing does not test viral load and therefore cannot determine if it is present in sufficient quantities to sicken you. If you feel sick and get a PCR test, any random virus DNA might be identified even if they aren't at all involved in your sickness, and this leads to false diagnosis. Coronavirus are incredibly common. A large percentage of the world, human population, will have COVID DNA in them, small quantities, even if they are perfectly well or sick with some other pathogen. So the implications are quite clear. If you want to create a totally false panic, about a totally false pandemic, pick a coronavirus. They are incredibly common and have many different varieties. A very high percentage of people who have become sick by other means like flu or bacterial pneumonia, many other causes, will have a positive PCR test for COVID, even if you're doing the test properly and ruling out contamination, simply because COVIDs are so common. There are hundreds of thousands of flu and pneumonia victims in hospitals throughout the world at any one time. To create a false claim of pandemic, all you need to do is select the sickest of these in a single location, say Wuhan, administer PCR tests to them, and claim those few people showing viral sequences similar to a coronavirus are suffering from a presumed new disease. Since you are already selected the sickest flu cases, a fairly high proportion of your sample will go on to die. You can then say that this new virus has a case fatality ratio higher than the flu, and use this to infuse more concern and do more tests, which will of course produce more false cases, which expands the testing, produces yet more false cases, so on, so on, so on. Before long, you have your pandemic. Totally fabricated. All you've done is use a single test kit trick to convert the worst flu and pneumonia cases into something new that doesn't actually exist. Now just run the same scam in other countries. Make sure to keep the fear message running high so people will feel panicky and less able to think critically. Your only problem is going to be that because there's no actual new deadly pathogen, but just regular sick people, you are mislabeling your case numbers and especially your deaths. So your actual deaths attributable to coronavirus are going to be way too low for a real new deadly virus pandemic. But they are preventing people from pointing this out in several ways. First, they claim this is just the beginning and more deaths are imminent. They use this as an excuse to quarantine everyone and then claim the quarantine prevented the expected millions of dead. Second, they tell people that minimizing or downplaying the dangers is irresponsible and bully people into not talking about the real numbers. Third, they talk nonsense about made-up numbers, hoping to blind people with pseudoscience. And then fourth, they start testing well people, who of course will also likely have shreds of coronavirus DNA in them, and thereby inflate the statistics with people with no symptoms. Then they spin that to sound deadly, even though any virologist knows the more symptomless cases you have, the less deadly is your pathogen. Take those 4 simple steps, and you can have your own entirely manufactured pandemic up and running in weeks. But the fact is, no one can say there's a pandemic when there is no accurate or proper testing being done. This is why in most places you will not see a lot of dead people. And if there's a place where a lot of people are dying, no one really knows if it is COVID-19 that's killing them. So that was the Global Research article from late March 2020. If you believe that any information in that article is inaccurate or misleading, please post your response in the comments or contact the producer of this video. When you respond, please provide factual evidence for your position. Whether you think that COVID-19 will kill millions of people or not, you have a right to your opinion, and you have a right to respond as you see fit. Society can be seriously divided and damaged by people who insist that everyone respond to a crisis the same way they do. Should we wear a mask? Should we use bleach? Should we get vaccinations? These are not government's choices. These are your choices. We not only have to look out for ourselves, we have to respect how other people choose to look after themselves. If you feel someone is being careless or causing a hazard, be polite and respectful in how you deal with that. If you think people are overreacting, be polite and respectful in how you deal with that. When we are fighting among ourselves, we simply invite the state to intervene with force, violence, and control, and that is something no one needs. I'm going to speculate as to why all of the media and our political leaders are whipping up hysteria over this idea of global pandemic. Our central banks and our governments have created a financial crisis by using unbacked, debt-based fiat currency, unlimited government borrowing, and impossibly escalating levels of taxation to service all the debt. We are very near now the end of our monetary cycle, where debt can no longer be sustained. Currencies everywhere are being overprinted and nearing collapse. Equity markets are irreparably overvalued, and our currency systems must undergo a major reset. As they desperately issue helicopter money for bailouts and giveaways, the currency will sharply inflate, and trillions of dollars of monetary value will simply disappear for most of us, as those who control currency will collect that wealth. In this process, many people worldwide will suffer losses, poverty, disruption, and sacrifice. Most people are not aware that this disaster was predictable and inevitable. Bankers and elite officials do know what is coming, and they know that people will see that they are to blame for this disaster unless they can come up with a scapegoat. Scapegoats come in the form of things like terrorism, global warming, and global viral pandemics. Manufacturing or exploiting some global threat not only allows blame for the economic disaster to be diverted from central banks and government officials, but also gives an excuse to impose authoritarian public policies so that riots and civil unrest can be harshly dealt with by state-sponsored violence and force. We are being suckered to accept a huge new set of restrictions on our lifestyles and personal liberties, so we will be powerless against official policy. And some kind of new world order can be imposed that without some fabricated crisis would meet violent public opposition. We have been made to believe that we must radically change our lives because of a pandemic. But we're actually changing our lives to relieve central banks and our legislators from the blame for what's happening to our economy. We have seen major stock market crashes. We have seen years of near zero interest rates. We are seeing public debt now multiplying by trillions of dollars per year. Just as central bank and government insiders have expected, our corrupt global economic and currency systems are unraveling. We now see that not only is public debt unsustainable, but even corporate and private debt are at levels where that debt can never be paid off. It's a mathematical impossibility. The cause of the collapse, the depression, the austerity, poverty, and social disorder is not a COVID-19 pandemic. The cause of the economic collapse is worthless, unbacked, debt-based currency, bad economic policy, greed, and irresponsible conduct by government and central bankers, and their belief that they can plunder the world's workers and business owners decade after decade until everything crashes, then pass the blame off onto some unrelated calamity that they either create themselves or exploit to their benefit. In 1913, when the Federal Reserve was created, future economic disasters like we are seeing today were unavoidable. But you are being asked to blame a virus for this supposedly unexpected economic meltdown. The lockdowns, the people forced to not work, the companies forced to not produce, the debtors who will be made unable to pay their debts, the quarantines, curfews, martial law tactics imposed, this whole insane reaction to an alleged pandemic will cause major economic damage. That is what it's designed to do. So all economic failures and crises from now on can be blamed on a virus, not on the people who created the economic corruption in the first place. We do not need to beat a virus. We need to prevent another fake, unbacked currency from replacing the last one. We need to prevent debt and taxation from accruing to pay for exploding public debt and financial mismanagement. We need to demand that no one pledge our future labor to pay for their greedy indulgences. As we slather our living spaces with toxic sanitizing chemicals. As we give up our true social contacts and become even more addicted to our tracked and monitored electronic social media platforms. As we allow idiotic government policies to close our businesses and destroy our jobs, would this not be a good time to think for ourselves and consider whether we are being told the truth, whether we are being used and set up by liars and corrupt officials for their own benefit? Can we do anything to reclaim our lives, our prosperity and hope? Or will we simply believe whatever we are told and obey whatever we are told to do? Obedience and complacency can be good, or it can be a terrible mistake. Trusting media and politicians can be good, or it can be a terrible mistake. I would argue that trusting this pandemic hysteria and participating in economic suicide is a terrible mistake.